Welcome to Adapt English Practice Question. This is Pharmacology, Psych Medication on Buspirone for nursing school and NCLEX. A nurse is reviewing prescription for several clients who has been prescribed Buspirone for anxiety. Which of the following prescription is appropriate? Buspirone for a client taking Phenelzine. Buspirone for a client taking Sertraline. Buspirone for a client who drinks grapefruit juice daily. Buspirone for a client prescribed Aprazolam PRN. If you're taking care of a patient who is being prescribed this medication, which of these do you think is appropriate to honor that prescription? Put down your answer in the comment. This is the question. A nurse is monitoring a client who is taking Quetiapine. Which of the following findings should the nurse recognize as an extrapyramidal symptoms, EPS? 1. Fever. 2. Muscle rigidity. 3. Autonomic dysfunction. 4. Mass-like face. If you're taking care of this patient and you recognize that this patient is on Quetiapine, which of these symptoms do you think indicate extrapyramidal symptoms? A nurse is caring for a client experiencing acute manic episode related to what? Bipolar disorder. Manic episode related to bipolar disorder. That's the buzzword. Which prescription should the nurse anticipate? That means the nurse should know what kind of prescription will be provided for a patient in manic episode of bipolar. 1. Diazepam. 2. Bupropion. 3. Valproic acid. 4. Methylphenidate. Which medication you think is very good to use in a manic episode of bipolar? I know you know it because you watch Adapt English. Put down your answer in the comment. A nurse is reviewing medication combination for clients in the psych clinic. Which combination should the nurse question? Wrong combination. That means side effect, and this is where you have to look at a combination, figure out the side effect and why it's a problem. Lithium and allopurinol, clozapine and diphenhydramine, Phenelzine and Pseudoephedrine, Fluphenazine and Buspirone. Which combination is the problem? These are psych medication. If you don't intervene, patient will be in trouble. Put down your answer in the comment. A nurse is assessing a client receiving fluphenazine. Which finding indicate a serious adverse effect? Once again, a serious adverse effect. Urinary retention, hyperpyrexia, dry mouth, insomnia. Which one do you think is very serious? Which one indicate a serious adverse effect? Put down your answer in the comment. A nurse is reviewing discharge medication for a client with anorexia. Which prescription should the nurse question? It's a select or apply. You don't have to pick everything. Pick those you're 100% confident about. Fluoxetine, methylphenidate, bupropion, ziprasidone, amphetamine. These are 5 medications prescribed to the patient with anorexia who is going home. Which medication do you think the nurse should question? This is a psych medication for what? Anorexia patient, eating disorder. What do you think they should go home with? And which medication they should not? Pay attention to the clinical pathophysiology of anorexia. Put down your answer in the comment. A nurse is reviewing prescription for 4 clients. Which drug should the nurse question? Amoxicillin with the history of depression, clomipramine, history of depression, bupropion, history of bipolar, Sertraline, history of anxiety. For patients, they have their respective history and they've been prescribed specific medication. Do you think they can take it? Put down your answer in the comments. Explain why you pick it. A client who is currently taking Sertraline is prescribed a new medication. Which of the following prescription should the nurse question? Metformin, Tramadol, or Dancetrone, acetaminophen, Think about it. If you are the nurse taking care of this patient, or you saw this on your NCLEX or nursing school or NC or ATI, and the question is, the nurse is caring for a patient who is taking Sertraline, all of a sudden a new prescription is being provided. Think about it. Metformin, Tramadol, or Down syndrome combination. Would the patient be able to take any of this medication while on Sertraline? I know you know the answer. Put it down in the comment. A nurse is aware of what? 4 clients, right? Which drug combination the nurse should question? Taking care of 4 clients, which of these combinations she should question? One patient is on clozapine and valproic acid. Second patient is on aripiprazole and benztropine. Third patient is on risperidone and lithium. The last one, Phenelzine and Fluphenazine. Which one do you think the nurse should question? The key is to look at the drug combination. Which combination is okay? The one that you know is not okay is the right answer. Think about it. Put down your answer in the comment. A nurse is caring for a client who has recently started Sertraline for depression. Which findings should be most concerning to the nurse? Once again, a nurse is caring for a client who has recently started Sertraline for depression. Which findings should be most concerning to the nurse? Prioritization, right? Most. Mild headache, dry mouth, diarrhea, and insomnia. If you're taking care of this patient who recently started depressive medication, antidepressant, and all of a sudden she's giving you these signs, mild headache, dry mouth, diarrhea, and insomnia, which one of them should you be worried about? Which one is most concerning? That's the key. If you know, you put down your answer in the comment